are the risk factors when treating an acoustic neuroma with surgery?
So the risk factors for surgery on acoustic neuromas depend upon a number of variables. The primary variable is the size of the tumor. We know that as tumors enlarge, the risk of surgical resection increases. And these risk factors are largely related to the fact that the nerves around the tumor become more stretched or potentially become more adherent to the tumor as the tumor is larger. And so if we kind of go down the list of these nerves one by one, we can talk about the relative risk factors. So we know that tumor originates from cranial nerve 8, which is the balance nerve and the hearing nerve. So one of the risk factors with surgery is related to the impact on hearing. So for a small acoustic neuroma with surgery, and let's say a 1 centimeter acoustic neuroma, surgery to remove the tumor can be associated with a fairly high chance of preserving the patient's hearing. As the tumor enlarges, the chance of maintaining the hearing decreases. And once a tumor is, for example, 3 centimeters in size, the chance of maintaining hearing with surgery is often 5% or less. The balance nerves actually enter the tumor, and oftentimes it's in order to remove the tumor, the balance nerves are actually resected with the tumor. You have 2 balance nerves on each side. The tumor originates from one of the 2 balance nerves. And so following a resection, a patient is left with just one of the 2 balance nerves on the affected side. Generally, balance recovers fairly well after surgery, and it's something where the patient may experience some balance disorder for a few weeks, a few months after the surgery, but generally long-term balance is not too significantly impacted. The next nerve that we should talk about, and perhaps probably the most important nerve, is cranial nerve 7, which is the facial nerve. This is the nerve that controls movement of the face. It innervates the muscles of the face. And if this nerve is injured, it can result in facial weakness or facial paralysis. So it's very important from a quality of life standpoint to maintain the function of this particular nerve. And the risk of injuring this nerve is a function of the size of the tumor, as well as the experience of the surgical team. We do know for small tumors, the risk of the facial nerve of a permanent injury may just be a few percentage points. And as a tumor enlarges, the risk of a permanent facial nerve injury may increase to perhaps as much as 5 to 10% risk. We've talked a little bit about cranial nerve 5, which is the trigeminal nerve. This nerve innervates the sensation of the face, the feeling of the face, touch, numbness, pain, temperature, all the sensory functions of the face. This nerve is a large nerve. It's usually tolerates stretch very well, and it's usually not symptomatic. And only about 5% of patients with acoustic neuromas present with numbness or pain in the face because of the strength of this nerve. The last nerves that are typically associated with acoustic neuromas are cranial nerves 9 and 10, and they're related to swallowing function. These nerves are only really impacted if the acoustic neuroma is large. Smaller tumors don't typically get to the point that they're touching or impacting cranial nerves 9 and 10. But for larger tumors, they can impact these nerves. And if these nerves are injured, then it can affect some swallowing function in the patient. Fortunately, it's unusual for these nerves to be affected by surgical resection.